Hello, everyone, and thank you very much for joining us today. My name's Deborah Garlick from Henpicked Menopause in the Workplace, Menopause Friendly and Menstruation Friendly. And today's session is all about menstruation and menstrual health. And some alarming statistics that crossed our desk at Henpicked was that 80 to 90% of people who menstruate experience symptoms. 73% of women struggle to carry out work in the way they want to, and 57% have said that they've had to lie to their manager about reasons for sick days. And one of the ones that I was a little bit, how does this work? 30 to 40% experience symptoms bad enough to disrupt their lifestyle. Now, we know millions of women struggle with their periods or menstrual health, but how do you know what's normal and how do you know what to do about it? And I think this is an interesting question because I'm delighted to welcome Dr. Clare Spencer from My Menopause Centre to talk to us more about this. And I know this is a very big subject, isn't it, Clare? We were talking about it before we went live around how many of us experience symptoms and actually just put up with it. It's just part of life. But there's a lot that we can do as well. So, thinking about those sorts of conversations, I'm going to have to jump straight in and say, what is normal in this space?
Yes, Deborah, hi, lovely to be here again. And the reality is there is a huge variation of what is normal, and what is normal to you might not be normal to somebody else. And so we know, so what is a period? Well, a period is actually shedding of the womb lining if you're not pregnant. So what happens every month, your ovaries almost pop a little tiny egg in ovulation, and with the hormone ups and downs that occur in the process of popping that little egg, the estrogen causes the womb lining to build up, and then the progesterone in the second half of the cycle causes that to building up to stabilize. And then if you're not pregnant, hormone levels drop down again before a period and the womb lining sheds. So there is a lot of variation in that. So we know that period cycles, so that whole monthly cycle can last anything from 23 days to 35 days. We know that the amount of blood flow that you shed is 20 mils to about 90 mils. If you imagine measuring that, that is really quite a large variation, and can be 2 days to 7 days. So that is the sort of variation amongst a normal axes. But yeah, interesting. We don't usually measure menstrual flow, but it has occurred as part of research processes.
In themselves, they're huge variations because when you're talked about it at school, and certainly the parlance, it's a 28-day cycle. If you're given the pill or something like that, you have a 28-day cycle. How many people actually do have a 28-day cycle that is just standard? We've seen the adverts, your flow can change on different days, but when you look at the variation, then it's easy to sort of understand this not really a normal, is there? Or is there a normal for me that might not be a normal for you?
Absolutely. And so then what's normal is sort of what you deal with as well. So there are those clearly defined parameters. So if you are having a period every 2 weeks, clearly there is something going wrong. But yeah, absolutely. What's normal for one may be completely to another, but then it sort of goes into, well, what can you deal with? Because some women I speak to deal with very heavy 3-week periods and always have done, and just thought it was something that they had to put up with. Whereas somebody else might not deal with that. Somebody else might be really anxious about the fact they're having a period every 6 weeks, because they feel they should be every 4 weeks. So I think, as well as the variation in what the period is, there's a variation on how different people deal with different symptoms.
And that one's interesting, isn't it? Because you and I usually talk about menopause.
Mm.
And we talk about that mysterious phase in the transition, which is the perimenopause, where things can go really skew with.
Mm.
Your hormones can be all over the place, triggering periods when you weren't expecting them, or a sudden flow, or flooding incident. And many of us can just think that's the perimenopause. The process that you described earlier is this rhythm. And
Mm.
in that time, then how many periods? Somebody can do the maths on this one. This could be months and months and months that somebody is struggling with their period and thinking this is just normal, isn't it?
No, absolutely. I mean, we're talking years that people often struggle, or they may go to the GP and maybe not get quite the right advice the first time, or it's clear, or it's difficult to know if what they're experiencing is abnormal. So that's why it's great that we're having these conversations, and it's great that we're pushing this conversation now into the workplace so people, women, can talk about what's going on, because we know that things can go a little bit awry. We know that there can be variations in that hormone up and down. For example, polycystic ovarian syndrome, and absolutely the perimenopause, where periods can go completely haywire. We know that different people can react more dramatically through no fault of their own, just how they're made up, to normal fluctuations. So some women will have premenstrual syndrome, and a small percentage of women will have a really severe form of that called premenstrual dysphoric disorder, PMDD. Some women will have a really heavy, floody period. Everything else can be totally fine. If you measure hormones, if you scan, everything can be fine, but just for no fault of their own, their periods are just horrible and heavy. And then there can be physical sort of abnormalities, and there can be fibroids, little knots of muscle in the womb wall that can cause heavier bleeds. There can be endometriosis, adenomyosis that we've touched on before, polyps on the lining of the womb, which can result in heavier bleeding, or bleeding in between periods, or more suspicious, sinister changes. So you sort of get a flavour there that there are lots of variations to normal, variations in how women react to normal, and then variations around anatomy, etc., and then certain gynecological conditions that then can also cause issues like heavy bleeding and painful bleeding particularly.
Thank you, Claire. And I can see comments coming up in chat with the words like fibroids, etc. And today's session, we wanted to cover the broader aspects. And I know in future Lunch and Learns, we're going to be covering each different condition, because as I mentioned before, I met a very inspirational woman on Sunday who has really struggled for years with endometriosis. And she's only in her 20s, and she's had it pretty much since the start of her periods. But with all of these different conditions, it's almost like, what's the trigger to knowing actually this may not be normal? Because I know that individual was saying that she'd been to see the doctors before and told, oh, it's just your period. It's just your period. And she was absolutely riddled with pain at certain times of the month, to the point of not feeling like she can move. So to get the words, it's just your period, you can think, I'm going to have to put up with this then for the rest of my life, and cut out parts of my month when I can't live a normal life. And it was only through persistency and actually her parents paying to see a private doctor that unlocked the diagnosis for her. So, thinking about, actually, could I be experiencing one of these? Is this normal? What might the triggers be for someone?
Yeah, so I think if you've got any worries, I'm really sorry that the person you were talking to had such a bad experience. I think the first port of call is, if you're concerned in any way, shape, or form about what's going on, talk to your doctor, talk to the practice nurse when you go and have your smear, but talk to somebody. And there are certain red flags that you really are advised to. So if your periods change, if they suddenly become heavier, if you're spotting in between your periods, or if you're bleeding after sex or any form of penetrative intercourse. So that's when you really, really should go and speak to a doctor, because that will need investigation. In terms of everything else, to answer your question, Deborah, I think it's tricky, isn't it? Because as doctors, we're here to help you, but I think education has a big part to play, which again, big tick in the box to Henpicked. It's understanding that, it's probably not normal to be crippled up with pain every month. Yes, okay, periods can be painful, but there is a lot you can do to help that pain. If you are experiencing negative symptoms, then just go and have a chat with a GP, because although it might be, in inverted commas, a normal variation, there will be plenty that you can do. There'll be loads of options to help manage that symptom. So education and seeking help and looking for strategies that can help your symptoms.
That's a key one, isn't it? Because knowledge is power in all things, but also knowing yourself. Because if you know if you like, for me, my periods were on a 28-day cycle. They were very light. So when I sort of hurtled into perimenopause and probably experienced flooding for the very first time, or periods happening when I wasn't expecting them, that was a big trigger for me. This is not me. And my husband would probably say my cycle was, I would be really, really snappy for days, and then I'd have a period, and that was my cycle. So there's also knowing yourself, sort of maybe even keeping notes for yourself, your diary or something like that, that sort of helps you understand your cycle and understand any points in there that are more difficult.
Yes, no, absolutely. And keeping track. And that can be really helpful, because if you know that you're going to be irritable and angry for 2 days before a period, then the positive of that is, although it is really grim, it's going to get better. So I think keeping a diary can be really helpful. And then also, if there are changes, and particularly if we're just going to turn the conversation slightly back to the menopause and the start of the menopause transition, you're in a really good place to know when things start to change and understand that it is maybe your cycle that is changing. Because, Deborah, I know we talk to loads of women who feel it's a personal failing if they start to have sort of particularly psychological symptoms of premenstrual syndrome or worsening premenstrual syndrome that can occur at the start of the menopause transition. And I think it can be really helpful to know it's just how your brain is reacting to those really powerful hormones that have such an impact on how your brain functions. Some women will say, I just can't think that day before a period. I cannot think. And that's because your progesterone level is dropping, your estrogen's dropping, and those changes can have a really significant impact. So I agree, in summary.
Yeah, so we've talked a lot about the periods, and the most
Yeah.
common types of do you call them menstrual problems, issues,
Yeah.
conditions?
Period issues, menstrual problems, menstrual issues. Yeah.
And you've mentioned endometriosis, which I know we've got a great lunch and learn with your colleague, Dr. Abby Lang. We're on PMDD. I think you mentioned that. Is that changes in mood?
PMDD is the really severe version of PMS. Absolutely significant plummeting of mood before a bleed.
Okay, we've got fibroids coming up in the chats. I'm sure we're not going to be able to mention them all, but any other sort of common menstrual problems?
No, absolutely. So flooding, where literally women will say, I'm wearing a Super Plus tampon and a heavy duty nighttime pad, and I am still having to change that pad every month. So that's flooding, which has a variety of causes. Polycystic ovarian syndrome is where you do have an imbalance of the hormones, which means that your periods are really sporadic. And that's important to know about, because sometimes the womb lining can build up to be too thick, and you need to have hormones to either induce a bleed or keep your endometrium thin. So they're the sort of the most common ones. We've got PMS, we've got polycystic ovarian syndrome, really heavy bleeding due to a variety of causes, including adenomyosis, which is a variation of endometriosis.
I was
Fibroids,
mentioned
yeah,
that one, yes.
yeah.
And when you're talking about those, and one of the in terms of the common thing, one of the things that you said right at the beginning, and you know, that flooding one where people are constantly changing during the night, you know, it's the knock-on effect it has on other things, doesn't it? Because you're not going to get asleep if you're going to be thinking about setting your clock, so you're getting up in the middle of the night rather than have to change the bedding next morning. But it has a knock-on effect in work and in life. But the thing that you said right at the beginning is it's important to appreciate that, you know, you don't have to be really, really bad. There's a lot that you can do. And what might those solutions be?
Mm. Okay, so if we talk broadly, they generally fall into non-hormonal options and hormonal options. So if you're having painful periods, there's sort of non-steroidal anti-inflammatory types of painkillers, if you're not asthmatic, can be helpful. So things like mefenamic acid is a variation of the ibuprofen, which is really good for targeting period pain. And if your periods are really heavy, there is something called tranexamic acid. So that puts a tiny little plug on the end of blood vessels in the womb and can make periods lighter. You do have to take it for 3 cycles to see an effect. You only take it when you're bleeding. So many women who don't want to take hormones find that really super helpful. If PMS is a particular issue, antidepressants can see you through. I know it's not depression, it's not anxiety, but using them for the different role of managing PMS, PMDD, they can be helpful. And lifestyle measures, as ever, can help mood changes with the menopause, with the menstruation as well. So, you know, surprise, surprise, exercise, reducing alcohol, diminishing caffeine can be helpful. Plus, there are some alternative therapies also. So there's a big lump of non-hormonal things that can help before you get into hormones.
And I'm going to add to that, chocolate always helped me, always got me.
Deborah.
I'm sure that's a bad thing to be saying. But you know, you just listen to your body, don't you? And for me, I always had a real chocolate craving before a period, where sweet things. But you know, that's part of the course. What about the hormonal side? Because I can remember a couple of my friends having the pill when they were younger to sort of balance out their periods.
Yeah, no, absolutely. So in terms of hormonal things, you can split them up into estrogen and progestogen containing contraception, basically, and progesterone only contraception. And again, you might not be taking it for contraception, you're taking it because it can help. So the combined pill has some estrogen and progestogen in it, and that can be really helpful for just flatlining that big up and down swing. And so the combined pill can help premenstrual syndrome, it can help heavy periods, and you can take 3 packets in a row. So you only say have a bleed every 3 months, which if you're having heavy bleeding is happy days. And yeah, and then things like the progesterone only, so the Mirena coil is brilliant for, in many women, stopping periods. The mini pill can be helpful. So there's a whole range of hormonal helpers.
That's really, really helpful. I'm going to ask my colleague Sally to join us because I can see there are a lot of questions
Yeah,
there,
I mean,
Sally. And
it's overwhelming the amount of questions. And again, as we always say on these sessions, just thank you so much for everyone being so open and honest. We've got people saying that they're almost in tears, realizing it's not just them and that they've been going through this for so many years and never been able to talk about it. So yeah, just really, really appreciate. So I'm going to go through the majority. There are quite a few questions around HRT. We've got resources that we've done special sessions on HRT, so we'll share the links to those, and ones on specific conditions like PCOS and endometriosis. And we are going to be doing one on PMDD soon, so we'll share details of all of those because within half an hour there's only so much we can cover. So one of the first ones was just, how do you spot the differences when something's a difference in menstruation and your menstrual cycle, or it could be perimenopause? So that's kind of how the two relate together.
Yeah, so I spoke right at the beginning about feedback mechanism. It's really complicated that occurs between your brain and your ovaries. And in the perimenopause, that feedback mechanism doesn't work as effectively. So often women just notice a change in periods. They start to become irregular. It can be a change in bleeding length. They can become heavier or lighter. And they've usually started to notice some symptoms as well. So either a bit more irritability or anxiety, start to have a few hot flushes, particularly before a period when your estrogen level is at its lowest. So combination of bleeding changes in timing, but can be length, can be heaviness, and other symptoms creeping in.
Yeah, absolutely. And I think that's one of the things when we talk about menopause is it's not always the change in periods that happens first. And I think that's that understanding. There's been some great sharing around some of the things people have done around acupuncture, reflexology, managing cravings with things like cinnamon and dark chocolates rather than sugar. So there's some really good, a lot of people have said tranexamic acid has made a big difference to them. So there's some really good things there. So someone said that they're going into this perimenopause stage, so they're having bleeds, but some big gaps. The GP has said to them they're not really periods anymore. So are they still ovulating? Just to get an understanding around what does it mean.
Yeah, so there is a tendency, and doctors do it also all the time, to cause any bleeding a period. So it's really difficult to know if you're ovulating or not, to know if it is a period. But I tend to think if you're not on hormones and it's bleeding and it's sort of cyclical, but it might be a bit erratic, you can probably call it a period. But if you're having a bleed on the combined pill, say you're on the combined pill and you're having a monthly bleed, that isn't a period because it's not your own hormones inducing that bleed. That is a bleed. And the same with if you're on sequential HRT, which is designed to give you a bleed. Again, that is a bleed, not a period, because it's the pattern of hormones that is making you have that bleed. Does that make sense?
Yeah, absolutely. And I think that's
great
just
question.
Really great. Honestly, there are so many amazing questions. We've got a lot of people saying that they're being told to put up with pain, being dismissed, feeling like they're taking ages, and then eventually being diagnosed with quite advanced endometriosis. So that kind of validation of the pain, but they've been through it for such a long time. I guess it's understanding what advice can you give to somebody to really advocate for themselves if they are in pain. I know things like, I think Endometriosis UK have a symptoms tracker, which I know people use and can be very helpful, but anything else, advice you can give to help people get that support they might need from their healthcare practitioner?
Yeah, I think if you are wondering if it's endometriosis, then as you say, Endometriosis UK, there's a good, nice guideline on endometriosis. Have a look at the information that's out there. And because with endometriosis, it might just be pain, but also it might be other symptoms like painful intercourse, for example. And then I would just go back. And don't be afraid to go back, see a different GP, see if there's a women's health friendly GP in your practice. And it may be that you need a referral and to gynecology. Endometriosis is really difficult to diagnose because you generally don't see it on ultrasound scans unless you've got complications like cysts on your ovaries. An MRI can sometimes see it, but may not. And actually, the diagnosis needs a general anaesthetic and something called a laparoscopy. So obviously, we're really reluctant to do that investigation unless you absolutely need it. So often it may be a trial of treatment, like trying some hormone treatment that is needed to help make the diagnosis. So it is complicated and it is tricky, but please just keep going back and asking. And it is difficult to give an exact answer. It's almost impossible in general practice, but the general practitioner can offer treatment that you can get going with that may change your life by taking away the pain. Yeah.
Fantastic, thank you. Someone's asked around what causes flooding and how do you know whether is it a heavy period, is it flooding, is it what, again, because I know we've also got this massive range, but what would be kind of those signifying that you maybe need to go and talk to someone and understand what's going on?
Yeah. So when women are flooding, women will tell me they're flooding. Like if you talk to somebody, you know it's flooding. It is literally your menstrual flow is flooding. So flooding versus heavy somebody else may say that that's just heavy menstrual flow. So it is a bit subjective. So, and the issue is you can then get a low iron because you're losing a lot more blood every month and you're not keeping up with diet, and needing an iron supplement. And if your iron is low, you can feel tired, low, even palpitations and dizziness. So to answer the question, it is quite subjective. And just if your periods are heavy enough, too heavy for you to deal with, or they're causing an issue, you're leaking through normal pads, then just go. There's no badge of honor here. Just go and have a chat with a GP. And increasingly around the country in general practice, there are women's health hubs. There is a GP who will be more trained in women's health. So find out who that person is.
Yeah, absolutely. And I think as well, it's when it changes. But if suddenly your period is much heavier than it's ever been before, that's often a sign that there is something that's changed,
Yeah.
or something that's going on. Yeah,
Absolutely. Sudden change, bleeding after intercourse, spotting in between periods, that they are changes to go and get checked. Yeah.
And someone's asked about bleeding post-menopause. So they've gone through menopause, they've had bleeds, they've been checked by the doctor but had no answers as to why, and it's now happening again.
Okay, so postmenopausal bleeding is bleeding after a year of no periods due to the menopause. And that definitely needs investigating because there can be sinister causes. So if it's been investigated and all was well, then what you do next depends on how long ago those investigations were. If it's been a good few months, I would say go back. Often the cause is just the tissue of the vagina, the cervix. The womb is really delicate after the menopause. And if that is the case, then, that can be managed. But postmenopausal bleeding does need investigating. So even though you've had those tests before, I would go back and have another chat with your doctor about it, because we just need to rule out any little polyps or anything more sinister going on. More often than not, it's nothing sinister, but just go and get it checked.
Yeah, absolutely. I've got a few people asking about adenomyosis. Again, that's another session that we're going to be running. So we'll keep posted on the hub for that being advertised, but we will be running a session specifically on adenomyosis. We've got a final question just from me, as a couple of people have asked around, again, if they've got conditions like PCOS or fibroids or ovarian cysts, and they're going into perimenopause, how do they know what's causing what? Do things get better or worse?
Yeah.
Just kind of understanding again that relation to those conditions.
Yeah, so PCOS can be tricky because you may be having sporadic, irregular bleeding, once every 2 or 3 months anyway. So again, it's listening to your body, understanding what the symptoms are, and keeping a track of those symptoms. So you may not be able to tell necessarily from your bleeding pattern. They may become more spaced out, even more spaced out. Things like fibroids, so you're having heavy bleeding, but with fibroids, the bleeding is usually regular. So again, although you might be having heavy bleeding with fibroids, look for changes. Adenomyosis, similarly, you might be having heavy, painful bleeding, but look for changes. So it's the changes plus what other symptoms are you experiencing?
Yeah, absolutely. Someone's asked as well if there's any or why there are fewer studies and research around Black and Asian women in personal experiences of really suffering with heavy periods. And I think in general, this is something that we notice around menopause as well. Just in general, research for all of us, I think, is limited on some of the impacts of these things. And I think in particular, there needs to be much more research that is inclusive of everybody to understand those differences and those experiences.
No, absolutely, because there are differences amongst certain ethnic groups. So, for example, Afro-Caribbean women often have more fibroids. So, absolutely, I agree. We just need more research. We need more data collection. I think it is starting to improve, and we are having more of these conversations, but we are nowhere near that yet. So, thank you for asking the question.
And I would probably add to that, Claire, we need to be talking about this more, because if you saw me going earlier, it was because I was reading some of the comments and you just think, you know, oh my goodness, there are so many people really struggling with menstruation and the menstrual health, and just putting up with it, wondering about things. There are so many questions. We do need to see a lot more information. And as you're doing today, talking about this, because the comment earlier around it, maybe it's not just me. I think that's a powerful one. Many of us think it is just us. And when you open up about it and you share it, so many generous people sharing their questions, tips, thoughts to others in the community. That is absolutely amazing. And we could talk about this all day. I know we can't do that because, well, you know, we don't have the time. But what I would encourage people to do is check in, because these are half-hour sessions, check in on the Menopause Hub. There are lots of resources on there, videos and the write-ups on there, so you can get plenty of, well, you can watch those again at any time. And thank you for sharing your ideas too on what you'd like to see us covering next, because I was just checking the schedule to see what's coming up next. Lots of ideas on what is really helpful to you in this conversation. Definitely the one about GPs, I think, is absolutely imperative. There are a lot of questions that are already covered on previous lunch and learns around perimenopause and HRT, etc. But maybe it's time for us to revisit those again. So we'll keep that information coming, and thank you very much for sharing those ideas with us. And special thanks for sharing your time, Dr. Clare Spencer. It's always a pleasure. And for Sally Leach, for managing all of those questions as you already do. And I know we'll download them all and go, well, what do we need to do to help people? So thank you very much for joining us today, and we look forward to seeing you again. Thank you.